Let's review pre-existing conditions coverage exclusions. As mentioned earlier, during the open enrollment period, coverage is available to all eligible HGEA members. This does not mean benefits will be paid out for any disability. Being treated for a health condition or injury during the 6 months prior to the effective date of coverage would deem that condition a pre-existing condition. A disability caused by that pre-existing condition may be excluded. However, having a pre-existing condition does not preclude you from coverage. An injury or accident may be the cause of a disability and unrelated to a health condition you had prior to the accident or injury, and therefore eligible for coverage. Let's take a closer look at a pre-existing condition coverage exclusion. A health condition or an injury would be considered a pre-existing condition if treatment was received within 6 months prior to your effective date of coverage. Treatment includes, but is not limited to, consulting a doctor or medical professional, taking or being prescribed medication regardless of you actually taking that medication, or receiving a diagnostic test for that condition. With enough time, a disability caused by a pre-existing condition may be covered under certain circumstances. If after the date of coverage, the effective date, you suffer a disability related to that condition, but you had not received treatment for that condition during the 12 months after your effective date, you can file a claim for benefits. Once you have been enrolled in the plan for 24 months, a disability caused by a pre-existing condition could be covered regardless of when you were last treated. The claims examiner will have the last determination if a claim will be paid. As generous as Income Protector is, there are a few exceptions to coverage. Listed are a few examples. Participation in the act of war would not be covered, a self-inflicted injury, participation in a riot, an injury or illness caused in the service of the armed forces will not be covered, and an injury resulting from driving under the influence of alcohol or drugs will also be excluded. Elective cosmetic surgery or an injury or illness in the commission of a felony will also be exclusions to coverage. Despite your choice of the 5-year benefit plan or the retirement age plan, there are 3 conditions that would limit benefits to a maximum of 24 months during your lifetime. Those conditions are a disability caused by mental illness, disability caused by substance abuse, or a list of special conditions which we'll get into in a few slides. Special conditions means those conditions which, when reported by your doctor, cannot be verified using generally accepted standard medical procedures and practices. For these conditions, benefit duration is limited to 24 months. Here are a few examples of some of the special conditions. Repetitive stress disorder such as carpal tunnel syndrome, TMJ, temporal mandibular joint disorder, chronic fatigue syndrome, and fibromyalgia. Again, please visit our website www.royalstate.com and access the Certificate of Coverage under the Long-Term Disability link for a full explanation of coverage details. There are other benefits available with Income Protector, so let's go through a few of them. The first is vocational rehabilitation. An assessment may be made for a person on claim to see if they can be trained or job modifications made to return them to an active employment. The plan will also assist in filing a Social Security disability claim. If a disability was severe enough to cause death, your beneficiaries will receive a lump sum payment equal to 3 times your last monthly benefit payment as long as you had been disabled for at least 180 days and received at least 1 monthly payment. After your benefit payments have been used up, you may qualify for a one-time personal care assistance payment equal to your last monthly payment, not to exceed $3,000. Certain conditions must be met for the personal care assistance, so please consult the Certificate of Coverage for full details.